Hey, you've been hearing a lot about this double masking. It seems to be a conversation that many people are having, layering a cloth mask over a paper surgical mask, that it may boost the effectiveness by a whole lot. We wanted to talk about it. We've seen the double mask coverings on Dr. Fauci, even the president. But we haven't really heard official guidance from the CDC as they wait for more hard data. We asked the question, are two masks better than one? So we figured we'd ask somebody right here in Los Angeles. We trust her voice. She's on the front lines. She joins us now, Dr. Tasha Dixon, of course, the lead family physician at MLK Jr. Outpatient Center. Good to see you. Happy New Year, my dear. So are two masks better than one? Would you recommend that to your patients?
At this point, it wouldn't hurt. We do recommend, we've seen all those cute glittery masks. They don't necessarily provide the best protection. We're monitoring, what CDC is saying, what our experts are saying. But right now, it doesn't hurt. We do recommend, if you want to do it, go for it. But with that, staying at home so you don't have to wear a mask.
Ah, that part. Is this something you more recommend for older people, or is it just anyone who feels that that's their comfort level? They feel better with two layers?
Anyone and everyone. No one's immune from COVID. And so,
nope.
From 2 years old and up, we do recommend wearing those masks. And so if you want to double up, be my guest.
All right, one of our crew guys said he tried 3 and he couldn't breathe very well, so three maybe not recommended. Can we talk about the variants? I think it's important to talk to physicians about this. We know that we're seeing more variants. We know this is what viruses do. They mutate. Talk about what really this means for you on the front lines and what we need to be aware of.
So what you should know is that CDC is really studying this right now as we speak to try to provide more guidance for us. What we do know is that the ways that you're going to be able to protect yourself from COVID have not changed. Okay. And so that's wearing the mask, that's staying at home, especially during this Super Bowl weekend, especially with Valentine's Day coming up. It means wearing your mask. It's the hand hygiene. It's the physical distancing. It's really staying at home when you have to, so that we can avoid the variants and avoid, everything that we've seen in the last almost a year now. A year, actually.
We hear about these new variants that they're more contagious. Can you explain to us what that means? Does it mean there's a greater percentage of people exposed will get sick? Does it mean that less exposure puts us at less risk or more risk? Dial into that for us so we can understand.
Yeah, so, the data is still coming out, but what I'll say is that it seems like, it's a greater risk of you getting it. And so what that means is that, if you're in a room, there's a possibility, but there was always a possibility right now that, you can get it. So I just want to get back to, we're waiting to hear from public health officials about, what else we can do. But going back to the basics, it's the hand hygiene. It's the getting your vaccine when you can.
Right.
And doing everything that you can. This variant is, we know that it's different, but it's not that much different in terms of what we can do to protect ourselves.
And it sounds as though that the current vaccinations do cover those variants, and that's what the CDC and the WHO are saying. Let's talk about what you just mentioned there, getting those vaccines. We know that you have been leading a push, along with many other Black physicians and Latino physicians, to try and get Black and brown people vaccinated. The hesitancy exists there. What are you doing? What are you finding that is helping convince people to get vaccinated?
It's really the stories. It's really, being proof. So I've been vaccinated. My mother's been vaccinated. I've been participating in the vaccine clinics, and the excitement in my community at MLK Outpatient Center. We've vaccinated now more than 500 people last week, our first week, and just to see the difference that it's making in my community. But we're not done. We're here to tell you that there are appointments. If you are interested in getting the vaccine, call your doctor. We are here to provide the vaccine. I can tell you that I felt fine after I got it. So it's really a great opportunity. It's an exciting time. And if you're worried about which vaccine to get, the one that's going in your arm is the answer.
How about that? That's the one to get, the one that is being offered to you. And again, I like your advice about reaching out to your physician, because I think there's been a lot of confusion, especially among some of our seniors. proactively reach out to your family physician and at least ask them. You can send them an email, you can call their office, and they can provide you information. Dr. Tasha Dixon, we love when we get to check in on you. You're so positive. Your energy is always so up. It's infectious, speaking of infectious, and you always give us such great information. Appreciate you. You stay safe, okay?
My pleasure. Take care. Stay healthy.